Hello, welcome to our live demo with the CardMedic team. Just a quick bit of housekeeping. This event will be recorded for our colleagues who can't join us today. I'm Claire, I'm a clinical change lead for digital health at the Norfolk and Norwich. I've had the privilege of working on implementing CardMedic since I joined in May this year. We're joined today with a couple of the members of the CardMedic team, Rachel Grimaldi, co-founder and CEO, and Morella Lingwood, operations and HR manager. So the agenda for today's session will include a discussion of the background of CardMedic and how it came about at the Norfolk and Norwich. I will then hand over to Rachel to explain the history and provide a demo of how to use and discuss the issue around consent. I will then follow with our onboarding process, some tips and tricks and some lessons learned as we were implementing CardMedic in the trust. And at the end, there'll be some time for some questions, and my colleague will be checking the chat and stopping us as we go if necessary. So just some background on how it came about at the Norfolk and Norwich. So our maternity services, they identified a need for accessible information. They were asked to produce all their patient leaflets in every language, which of course is not affordable or practical and would have been a massive task. So, and I think as health professionals, we're always wanting to improve communication and our patient experience. And as I said, in May 2022, the digital health change team started a project with CardMedic. We attended the Nursing and Midwifery and Clinical Professional Forum. We produced internal comms, we had an event, we did floor walking, and we talked to stakeholders. Our Meet the Maker brunch, it was a really successful event. I personally really enjoyed it. It included us as a change team and members of the CardMedic team. We made ourselves available to talk to staff about how the app worked and how to create an account, to use the location code, and to answer any questions that came about at the time. And at this point, I'd just like to hand over to Rachel to explain how to use the history and consent of CardMedic.
Thank you so much, Claire, and really lovely to see everyone here today. Thank you so much for joining. I'm Rachel Grimaldi. I'm an anaesthetist in my last year of training, working at Great Ormond Street Hospital currently, and co-founded CardMedic at the beginning of the pandemic. So I was just going to tell you a bit about what it is, the history behind it, run through a demo, mention some of the kind of tips and tricks for when you sign up, and also touch on the consent side of things. So in a nutshell, CardMedic is an app. It's a mobile app, and it's also available as a website or web app that's designed to reduce health inequalities that arise from communication barriers in healthcare. So that could commonly be a language barrier, but might also be deafness, blindness, cognitive problems like learning disabilities, stroke, dementia, autism, or literacy issues, which together impact nearly 50% of the population. And this group of patients do suffer from massive health inequalities and inequities I'm sure you're all very aware of, and increases their morbidity and mortality, mental health issues, reduces compliance with medication, can prolong length of stay, impact on their patient safety and experience, increase litigation, and so on. So what we're really designed to do, we don't want to replace any of your existing services around translators, sign language interpreters, speech and language therapists, or learning disability nurses at all. What we want to do is bridge those gaps in service provision. So where you can't get any of those services available, that might be urgent or out of hours care. It could be on the ward when you're just simply wanting to ask a patient, are they comfortable? Do they need the toilet, for example? That you're not necessarily going to phone a translator, or you don't have enough time or the logistics or a portable phone or whatever it might be to get someone to support that communication with the patient. We want to be there to make sure that you don't have to then rely on friends and family to communicate, or other staff members, or machine translation like Google, which is what we generally always turn to when we don't have the other services available. So Just to kind of take you back to where it all began, as I mentioned, it was the start of the pandemic. I was on maternity leave, visiting family abroad when the borders closed, and I couldn't get back to work. Otherwise, I would have just gone to intensive care, I think, to help. And I read an article about a patient who'd been to intensive care with COVID, and he described feeling terrified because he couldn't understand the staff through PPE. So I thought, how are people communicating? Are they writing notes on paper? Are they just shouting at patients or doing things to them? And I spoke to friends and colleagues who were working in A&E and ITU at the time, and they just said it was a really big struggle, and sort of doing a combination of all of the above. So there was obviously this acute crisis in communication in healthcare around the world because of PPE. And I thought, if people are struggling without communication problems, what about patients who speak another language, or patients or staff who are deaf, for example, or patient has a learning disability, and so on. So we thought, rather than people trying to write notes on paper, what if we created this library of notes, or scripts, if you like, that replicate what we commonly try to say to patients? So a kind of standardized library in a really simple A to Z format that you can choose the script that you'd like, show it to the patient on a screen, and it would guide the conversation. The screen being either a mobile phone, tablet, or desktop. So it was very rapid. It was concept to launch in 72 hours. And I wrote some scripts. My husband, whose background's not medicine, it's technology and e-commerce and things, built the website. We launched, initially shared it with some friends, and then 24 hours later, a good friend of mine said, you have to join Twitter, which was originally where we connected with Norfolk and Norwich as well, when we found out that CardMedic had been put on all the iPads. And I think part of that was the maternity services really needing it as well for that acute communication. So so we, within the first 3 weeks, just through word of mouth on Twitter, had 8,000 users in 50 countries, primarily UK and the US, and then beyond there. And then we had some media coverage at the 3-week mark, which went around the world. And the feedback that we'd had from patients and staff, members of the public and carers, was, please can we have this to stay as a communication solution, for all the reasons we mentioned before about the health inequalities that this huge group of patients face that have communication barriers and the poor outcomes, and the fact that we have a big gap in service provision. And we're meant by law with the Accessible Information Standard to ensure that patients always have accessible communication support available, but we know the realities and logistics of organising that can be really challenging. So that's where we sort of found ourselves in a scenario of taking what was just an idea to help some of my friends into creating something that's a sustainable app. And so the content library has grown to nearly 800 scripts. We've got a lot more to add, actually, so it's going to very shortly be over 800. They are all written by healthcare and allied healthcare professionals. We have a whole range of specialties on there, but just to say, it's absolutely not exhaustive. As we know, clinical practice is endless, and it's not just limited to, you know, clinical practice. It could be used to welcome someone onto a ward or into reception, or organising discharge. It can be used in the community, primary care, on a ward, in the back of an ambulance. We're working with an air ambulance, so it really is in any healthcare setting. We've got midwives who go to hotels to work with pregnant refugees who like to use it, and so on. But it's not exhaustive. So the way that content library has grown has been through people contributing scripts, because not only does it help yourself and your colleagues, but helps patients across the country. And actually a huge part of what we're really passionate about is reducing health inequalities globally and making a positive social impact globally. And we've worked with refugees already in Kenya, in Kakuma refugee camp, to do some of our translation work. We've supported humanitarian crises. We've had a paediatric critical care retrieval team use it as well in Ukraine. And we want to fund training for community health workers for refugee camps, and provide grants for female entrepreneurs and healthcare entrepreneurs in developing countries. And so the content is really far reaching, and supports patients and all across the world, in all countries and healthcare settings. So So when you see the library, when I do the screen share in a moment, just to bear in mind that it isn't exhaustive, and we're really keen to get your feedback and to get ideas around content. And if you're happy just to throw your ideas on a Word document, email it to us. We can put all of our emails in the chat, so you've got one of many to choose from to email this to. Then we can edit it, send it back to you for review, and then upload it to the website or the app. So very straightforward process from that perspective. And you'll see the style of it's really simple. We aim for reading age around 8, and then the easy read reading age around 6. So I will do a screen share. Hopefully my Wi-Fi will be okay this time. I'm going to wait to just double check it's showing on the screen. Thumbs up from presenters if you can see it. Perfect, thank you. So this is the website version. I can't see anybody else at the moment, so do shout if anything goes wrong. But this is the website or web app version. As I mentioned, it's also a mobile app. They're exactly the same. It's just some of the icons are in slightly different places. It's, as I mentioned, this A to Z library with 800 odd scripts. I'm going to pick out a few areas, but please have a download, and I will talk about that in a minute. Have a play with it, and if there's not something on there, then let us know, and please get involved with helping write the scripts. But just some of the sort of key areas. It's generally alphabetical order, but of course airway, breathing and circulation are at the top, because as we know, they're how we manage our emergencies, our initial approach. But you'll see this sort of content relevant to critical care. We've got an air ambulance section, alarms, allergies, pain relief, antibiotics, audiology, some cardiovascular content. I'm just picking out some of the some areas, but there's a lot more. Dental, dermatology, bits around diabetes, emergency medicine, end of life care, examining patients, fluids, GI, bit around kidney injury. Again, for refugees, how the NHS works, or for immigrants, how the NHS works, just a section on there, really simple. Taking a history, some housekeeping and comfort care as well. We've got bits for identity check around transfusions, investigations, max facts section, medications, big maternity section. Some neurology, nutrition, obstetrics, oncology we're building out at the moment, ophthalmology. We've had scripts recently added to their pediatrics, pain relief. We have a section here on patient questions, so patients can ask questions of staff. For example, what's wrong with me? What do my test results show? Can I have a second opinion? And there's a whole library of questions in there that patients can ask of staff. Radiology, sepsis, sort of personal care, toilets, cleaning your teeth, those sorts of things, catheterization, vaccinations and so on. So, but a lot more than I've just highlighted, but just shows you some of the areas. It is more focused on, we do have a primary care section we're building, but it's more focused on secondary care at the moment, purely because of who's come forward to contribute. But I'll just show you the airway section, just it showcases the features of the scripts, but as you can see, they're written in a really simple way. We want it to ideally be intuitive. You can just pick it up and start using it. As a member of staff, this will generally be you initially directing it, but a lot of people have asked, can patients download this? And absolutely, patients can download it as well, with your help if you want, or they can just do it independently. And so they can see, they and their families can see what you've talked to them about. But it's written really simply. We try and avoid jargon, but if a patient will hear a word like ventilator, cannula, speculum, all those sorts of medical words, if we do have them in a sentence, we will put, say, breathing machine or a small tube, plastic tube, those sorts of things. We try and keep it professional, but also friendly and reassuring. So a team will be looking after you. You'll not be alone. Some of the scripts are longer. So if you click this icon here, it will just divide that script up into one sentence at a time. And you can navigate using the arrows backwards and forwards. And it might be that you only really want to show 1 or 2 sentences in a script, so that allows you to do it. If your patient can't read for any reason, they're visually impaired, they've have got literacy issues, they're too unwell to read, you can press play, hopefully my sound will share, and it will read the card aloud for you. You can speed this up, slow it down, pause it. If you press play, it will read the entire script like this. Or if you have one sentence at a time, it will just read that one sentence and then pause. So I'll just do this sentence to show you.
You are unwell and your lungs are tired.
And then it will stop and wait for you to press play for the next sentence. And you can scroll through. Or if you say, actually, I want to read the entire script at once, you can display the whole script, press play, and it will just keep reading it. We have different languages I'll show you. We have 44 languages on here. These are a mixture of human and machine translations. The human translations are all done by professional translators and clinicians. The machine translations is because we're growing so quickly and so many people are asking for more languages that we have just added a lot more languages. But in the back end, we have a translation management system where we can flag what's been translated by humans and what's been translated by machines, and we know what's outstanding that needs to be human translated. But just to show you an example of Spanish, you get the patient language on top, English or your language underneath, and again you can divide the script up, and when you press play, hopefully this will work, with the screen, with a sound share, the card will be read aloud.
Usted está enfermo y sus pulmones están cansados.
And then you can again skip through those sentences if you like. So that's just to show you how the languages work. We have sign language videos. Not every card has sign language yet, but we've got our maternity and emergency cards have sign language. If you press play, you can see the subtitles underneath. These are signed by signers who are born deaf. They're recognised by the deaf community, and this is particularly a lifeline for patients who rely on BSL, but also their partners who might rely on BSL as well, so they can understand what staff are saying. And maternity has been a really good example of that on the labour ward, where the partners are then able to understand what's happening during labour. And deaf staff as well. We've had a lot of deaf staff approach us about this, and for many people it's a lifeline if BSL is their first language, because English, written or spoken English, might be their second or third. So for them, it is almost like a foreign language in a way. The sentence structure and the syntax is very different. So the videos are really helpful. We have Easy Read. This is all written by speech and language therapists and learning disability nurses. And it is, we've also had the involvement, patient and public involvement's key. So we've involved national charities, including Alzheimer's Society. We've done regular focus groups with them, Parkinson's UK, Headway, which is a brain injuries charity, Include, which is a learning disabilities charity. And we've worked with patients who've had a stroke before, patients who are aphasic, unable to talk, or autistic, to get feedback. One of the things they asked for was one sentence at a time, which we've done, so you can scroll backwards and forwards. We had widget symbols, which are sort of, and we do have links to some of the communication boards with pictures and one word on them that you can point to, but the feedback about widget symbols was mixed. People that would actually prefer photos. So we're looking into what are the most inclusive photos that represent everybody with cognitive impairment, not just those that might appear to have a chromosomal abnormality, as it were. One of the other things they asked for was the ability to change the colour of the font and the background, and these were the three most popular colour combinations. Again, this is available for the whole site, so the entire site, not just the Easy Read, will change. Put it back to default. You can send this card to the patient if you click this arrow, either on the website or the mobile phone. It will give you options to email or text or send as a WhatsApp, for example, but it might be easier just to help the patient download it on their own device. If you favourite it or your patient favourites the card, it appears in your favourites library, which I'll show you in a moment. And the last thing to show you is question mark takes you to any questions, which allows your patient to ask you some more questions. Though, of course, if there's a language barrier, it might be that you just need to arrange an interpreter for that patient, or you can use the inbuilt chat tool where you can talk or type into this in different languages to allow for two-way communication. The only caveat is that this bit is live machine translation, so we don't want this to be used to base your clinical decision making on. This is just to support extra communication in a really simplistic way. You can translate it, you can press play again so it can be read aloud. Almost all the languages do have read aloud functionality. There's the odd language, for example, not the odd, but the occasional language, like Somali, for example, which the back end just doesn't support Somali read aloud. But in the pipeline, we're doing voice banking, where you can essentially speak a dictionary worth of words, have them recorded, and then it will sound like a human's reading it aloud as opposed to a machine. So that's in our roadmap in the future to include. If you click CardMedic, the logo will take you back to all the cards again. Just to mention a couple more things about sign and also around consent. So about the consent side, we're not a consent tool. There are e-consent tools available. Lots of people ask us about being a consent tool, and it's not something that we'd never explore, but there are tools out there available. The kind of crossover is you become a medical device. There's a lot of legalities around it, and we don't want to repeat what other people are already doing at the moment. What we're focusing on is what we're best at, which is bridging those gaps in service provision and just being that communication support tool. So we do have information on here which you could use for procedures that you normally get verbal consent for example, cannula, catheter, even blood transfusion, things like that. We've got the information on here. But something like an operation where you would need to go through all the risks and benefits in a lot of detail and ensure it's really accurate, we can have the information on here to a point, but where we stop and draw the line is saying, please sign here, this is your official consent. What our line is to say you must still use your trust protocol for consenting for these procedures that you would normally get written consent for. So the only other thing about the signing up process is when you sign up, you ideally use a hospital email address, but don't worry too much if it's tricky. But if you use your work email address, as soon as you've signed up with an email address and password, you just need to verify your email. So log into your work emails or whatever your email account is. If it's not appeared, and it should appear almost straight away into your email folder, just double check your junk folder. Once you've verified it, you'll be able to log into your account. When you're signing up, you should be able to add the license code to access the entire library, but just in case you haven't seen that option or for some reason it's not there, then if you click onto your profile on the website, it appears as they call this a hamburger menu, but on your app it appears as a little icon of a person with a sort of cogwheel next to it. If you click on that, you go to profile, you can enter license code there or location code. We're not allowed to call it a license code on the Apple Store when it's the app version. So on the app, it says location code. In the next, I think, hopefully month or two, you should just be able to log in through your email and not need to put in a code. So it should just automatically connect to your trust. But at the moment, you just need to pop in a license code, click save, and then you'll be able to access the full content library. Just another couple of things to mention when you sign up. There is a drop-down list of occupations. If yours isn't on here for whatever reason, please do let us know. There is one for patient as well. But if you just choose your occupation and then just pop in where you work, some people write NHS or hospital, or rather not say, which isn't massively helpful because the trusts and the ICSs who we work with, of course, just want to know how many people have signed up and what specialties are using it. So it just allows us to tie that together. We haven't got anything that's personal, patient identifiable. We're not sort of tracking individual users, but we just need to be able to feed back overall trends of data usage to the trust or the ICS. So if you just pop in your role and the hospital you work at, and ideally your work email, that would be fab. You can choose what language it appears in. On the app, you're also able to choose want to have it in the sort of black and white colour combinations, or black and yellow or green and white as well. And you can add your photo if you want, you don't have to, just so your patient can see you behind the PPE mask. So I will stop presenting. I'm sorry I've talked at everybody for a little while, but I hope that's useful and covered the main features. Just to say again, we are really, really keen to get feedback. We want to know. It's always nice to hear what works well, and we love to hear those use case stories. That's really important as well for the trust to hear. But we want to know from a user perspective what doesn't work well, what can we improve on, we know every hospital has Wi-Fi issues, and in the back end we're training our app to know when they're in low signal versus Wi-Fi, and so hopefully by the end of the month we should, if there are any Wi-Fi issues, it should improve from that perspective. But please let us know any issues. Please do get in contact with ideas for content, and just as you've seen, the style of the script's very straightforward, so to send those across to us, or any other bits of feedback or features that might be helpful and so on, because we are all ears and we're learning all the time. So thank you. I'll hand back to Claire. I'll put myself on mute, and if there's any questions, be delighted to take them. I think you're on mute, sorry.
Sorry. You should be able to hear me now. So onboarding at the NNN. So we had we've got Trust devices and desktop, and the CardMedic was added to both of these. It was installed on the devices. We encouraged, the app was available for staff to download onto their own devices and onto their own devices from the appropriate app store. We had posters produced, which had the QR code on, which helped with ease of download of the application. And we also, on those posters, we had the location code added, so people could easily access the full content of the application. We posted on Facebook, Twitter, and LinkedIn. We sent out comms internally, and we understand that people aren't always able to access their emails due to trust pressures, or just as part of their role as something they don't do day to day. So, you know, we were floor walking internal network. I was personally telling my friend colleagues about the app and what it could do and how it could help them in their day to day. And we piggybacked off other projects. For example, we've just rolled out Alertive into the trust. So when users were coming to us for devices, we were sharing info about CardMedic at the same time, giving demos, helping them log in if they needed to. So a few lessons learned. Like Rachel said, we just needed that clearer process to use a work email, get your email verified, checking your junk mail, and adding that location code to gain that full content of the library. We want you to include your occupation, like she said, and you know, where you work, and not just say in NHS, say in the Norfolk Knowledge. We used varied forms of communication, so we want to look into lock screens. We have obviously designed our Teams, Microsoft Teams background with info of CardMedic to gain a talking point when we're in different types of meetings. And as I said, trust pressures, we were just trying to be loud and trying to help and be available to help people. And that went really well with the Alertive project. That when we were floor walking, helping with that, we could talk to people about CardMedic and get the info about that as well. And I think we've had a really good relationship with CardMedic, but I've really enjoyed working with them. I said, you know, we're both very flexible on each time. We've had weekly meetings. We're keen to take, you know, suggestions from them and hear their ideas. And I have noticed in the chat there's about two-way talking. There is the chat feature on the app, and another way of getting around it is maybe using two devices. So you could have a device as the staff member, and your patient could either use their own, or we could gain another device, so the communication can be quicker and would flow easier rather than keep stopping and changing. So going forward, I think, like Rachel said, CardMedic are quite, they want new content, they want ideas. If there's a language there that is missing, when we did our Meet the Maker brunch, a few different roles explained that Lithuanian was the language they were struggling with. So that is now on the app to help us. And if you want to add that content or have any ideas, we've got a Proforma that you can get from us at Digital Health. We will then send it on to either Morella, Rachel, or just directly into CardMedic. And going forward, we need to survey our users. We need to find out what's going well and what's not so well, and any, as I say, any ideas. And we want to find out how it helped them. And if there was still any issues with barrier of communication, we want to learn from experiences. As I said about our alertive rollout, we've created an alertive support role. It's just going to be there for a couple of weeks, just to get, if people want a quick access, they want a demo, they want some more information, it's there for people to use. We've also created a SharePoint. The location code, training videos. I think that eventually this video will be available for people to access. And we want to continue meeting with CardMedic. We want to continue a relationship and continue growing to help communicating with our patients and each other. It's been a really lovely project to be involved with. So at this point, I think we're at a point to ask if there's any questions, and maybe we can get Rachel back to answer some of those. I've just put on that slide there, the QR code, if anyone wanted to use that to download the application on their device. I've blanked out the location code just so if this is going out to other trusts, they will have a different location code. So if you need that location code, we can get that to you.
Thank you so much. That's really helpful summary. And yeah, we're really keen to continue working together and just improving this all the time. It needs to work for the end users, which are staff and patients. And so if there's anything that we can improve on, then we are absolutely all ears. I work 2 days a week clinically. I've used it on the shop floor, and it's just, it does what you need it to do when you're struggling to communicate. You don't have any other resources around you. That's what we're trying to do, is to be that tool in your pocket. So I just was going to have a look through some of the questions. So thank you so much. Caroline said, does this have the ability to become a two-way conversation? Can the patient talk into it and it will translate back? So hopefully, Caroline, through the demo that helped answer it, that we do have the inbuilt chat tool where patients could talk or type into it as an option. We have links to communication boards. It literally is called communication boards, and it opens up some widget communication boards with pictures people can point to. So that's another option. We have that patient question section where patients can ask questions of staff. And with the style of the scripts, what we try and do is write them in a way that they primarily ask for yes or no answers, to keep it really simple and unambiguous, because we know that patients are always anxious, and you know, as are we. If I'm a patient in a hospital, there's always that sort of level of anxiety of it's hard to take on board all the information or remember what to ask, or for some patients, you know, their relatives say, can you ask this, can you ask that, and patients forget or don't quite know how to word it. So we don't want to stress people out and ask them questions that require very detailed answers without having a translator present if it's something that requires that. So we try and keep it really simple by asking primarily yes or no answers to keep it unambiguous, but also to always have that option open of organising a translator or something a bit more formal. But hopefully that helps. We would like to, if we can, create almost like a library of sign language GIFs. So just really short responses that people who are deaf and rely on sign language can choose as a response to a question. So they read the sign language bit and it has subtitles underneath for the hearing population. So that's in our roadmap as well. So we've got loads of ideas around that and beyond in the pipeline, which sort of takes me on to a question about, are we looking to introduce ASL? Absolutely. So we've got American Sign Language and Spanish Sign Language on our list. We have 7 sign languages on our list actually, but as I'm sure you can appreciate, the sign language videos are very expensive to produce, and they're also very labour intensive. So we're just kind of road mapping that out to create batches of them as we go, but it just takes longer to do than the written translations, but it's been on our roadmap for a while, so absolutely we want to include more sign languages. And yes, if you would spot any mistakes in the translation, bearing in mind that the ones that have been machine translated, it will say at the bottom they've been machine translated. Apologies, I've got children on half term, so they've just come in. So it will flag up if it's been machine translated, but it will all get human translated. So if the emails are below that you can feed back to, or straight to the digital health change team as well, that email's there. And someone's mentioned about doing a section for gender identity, sex, for trans or non-binary patients. If there's someone that's happy to write the content, because we just want to make sure that all of our content is written by people who are experts in these areas and know how to have these conversations, some of which can be very sensitive, then we would love to include that. It really is a content library, so you really can include anything. I think, oh, that's helpful. Morella, are you able to make a note about clinical psychologist or assistant psychologist? That's really helpful, thank you, because it's not exhaustive, that list, and we just added it recently, so there'll always be things to add. So Morella, if you're happy to take a note of adding that to the list, that would be brilliant. And thank you very much, Phil and Sarah, for adding into the chat as well. So I think that's covered all the questions, but if there are any more questions, please let us know now, or otherwise over email after, and I'll just pop myself on mute. Thank you.
Thank you, Rachel. I think that brings the session towards the end if there's no more questions. Rachel's popped the emails into the chat, or if you need to get hold of them at emails, you can get hold of us at Digital Health and we can help you forward your questions on, or you can ask us. So we hope you found this helpful today, and hopefully this you can get using this with your patients. So I think we'll call that a day. Thank you very much.